Hi, everyone. Thanks for joining. My name is Katherine Ornstein. I'm a professor at Johns Hopkins School of Nursing, and I am co-leading the Research Innovation Corps as part of StARS, which is the State Alzheimer's Research Support Center, which we will now be calling StARS. Along with my colleagues, who I'll introduce in a moment, we want to share with you about a new grant that we're launching. This is our second year of launching these grants, and the purpose of today's session is really to show you exactly what to do for your letter of intent. So just some housekeeping. We're going to, Dr. Sloane and myself, we're going to go through our slides. And then we will, if you have questions, just use the Q&A box for questions, and we'll hold those till the end of the webinar. And we have plenty of time to make sure everyone understands next steps. And you also can, if you think about things and have further questions, please use our email, StARS Center. We use this for everything, so we do not miss anything. And also, we try to do our best. So we evaluate what we do, and we will have a short survey at the end. If you can fill that out, that would be helpful to us. And of course, if you cannot stay the whole time or you want to share this with others, we will be recording this and posting it on our website. So I guess, the first step is to explain to folks what StARS is. You don't need to know everything about StARS, except it is funded through the NIA, and uniquely, it's a cooperative agreement. So we work closely with program officers through the NIA to make sure that our work is done well. So through that partnership, the goal is really to work with states and organizations to really advance and support dementia care. Specifically, what's unique about this is we're really interested in building data and building data accessibility with the idea that we have a lot to learn from each other. We have a lot of data that we're all collecting in different states that we want to share and really improve data infrastructure specifically around dementia care. So we are in our second year of StARS already, and this is our second launching of state grants. So the StARS team is gigantic. As you'll see, you do not need to know everyone there at all. We are part of the Research and Innovation Corps, but just to know, again, we have strong involvement from NIA and as well as just multiple institutions that are part of this initiative. So again, my name is Katherine Ornstein. Phil Sloane, my partner in crime, will come on as well. And we have several folks in our team that really support this work in terms of selecting grants, supporting grants, and disseminating information. Okay, so these grants, what's the point? So the real goal here is to advance dementia care services. We want something innovative and really to shape future policies. Important number, $110,000. That is total. So again, with your university or organization indirects, we will give out $110,000. But in addition to that, we don't just give you money and walk away. We actually try to provide expertise throughout the project to support you because we want these to succeed. And really what we're looking for is collaboration within states as well as state organizations that are serving the dementia care community. Again, enhancing accessibility and effectiveness of dementia care. So dates, very important slide, and this will all be on our website. Our due date for the proposal is, for the letter of intent, is March 12th. So that's about 6 weeks away. We have had this process before. We had a very competitive, we had more than 50 states applying with letters of intent. We will select a number for a full proposal. This year, we're planning to select about 6. Folks will be notified at the end of March that they will be selected for a full proposal, which will then be due May 21st. We will, through a rigorous review process, we'll describe later, we will announce awardees on August 1st with a start date of September 1st. So again, we have a total of $110,000. And importantly, you have a lot of big ideas, wonderful ideas. This is really a 1-year project timeline. So that's important to think about. What can you reasonably accomplish within 1 year for that amount of money, of course. And again, you saw that big picture with all of us part of the team. We will support you in terms of virtual meetings. I'm going to let my colleague, Dr. Jutkowitz, speak soon about data consultations. And we will give you feedback on project progress as much as needed. So again, to really ensure success. So eligibility, it's open to state, county, city, tribal governments, nonprofit organizations, academic institutions. And we not only we encourage collaboration with partners, but we do need one lead organization to sort of set up a contract with. And we really are interested in organizations within that you may work with or you may be part of yourself that are involved in statewide dementia service provision, or multiple. We have projects that are working with several key organizations in their state. Obviously, it depends really on how big your state is, how varied your state is. And I will also note that it's not just your one state. Your work could look at multiple states in your region, if that was appropriate, or really just a region within your state. We certainly have larger states, and that perhaps not one organization serves the whole state. And we're also interested in, we'll give priority to states new to the StARS network. And just to show you on our map, we have, again, already are working with many states. Some states were pre-selected. These are blue StARS states, we call them, just to do more in-depth development of their activities and research. We selected grants last year, so those are currently underway. So anyone can apply for a grant this cycle, but we really are interested in folks that are new to our StARS community, just so we can do our best to serve. Okay, so luckily you guys are not our guinea pigs. We already had a cycle of those. And the current funded projects are in Tennessee, Texas, Vermont, and Wisconsin. We're super excited about them. You can read more about them online. They're just getting started now. But if you're part of our Learning Collaborative and our StARS community, you'll definitely hear more about them. And they're really all very different. And that's exciting. And we wouldn't have expected these. Folks were really creative and really provided some interesting and exciting ideas. In Tennessee, for example, they're doing work on dementia screening through the annual wellness visit. There's a project in Texas, very cost of dementia focused, using all payer claims databases. Vermont has put together a really exciting project, working with several different state organizations. And Wisconsin is an example of a state that we are already doing a project with as a StARS state, but they also have a grant examining effectiveness of their dementia care specialist program. So very different states, very different projects, and we're really excited to see them all this year. So with that, I think I mentioned earlier that a key focus of StARS is not just these really cool, interesting projects, but about building data structure. And so with that, I want to pass it on to my colleague, Dr. Juckowitz, to talk a little bit more about that.
Thanks, Catherine. Hi, Eric Juckowitz, co-lead of the Data Core. Callie Thomas is the other co-lead. So, as Catherine mentioned, building data infrastructure is a main feature of the grants, and we have a general schematic for how we've been thinking about two aspects related to data. The first is around data linking. Grants need to describe the linking of two or more data sets. These different data sets can be whatever is necessary, obviously, to answer your study question. But we really want to prioritize projects that are linking data sets, databases that have historically been challenging to do. So this could be linking different state agency data sets together. It could be linking, for example, a state level data or a county level data or a city level data with some sort of CMS data product. These are just examples. And really the idea is, again, to facilitate the linking of data that historically has been hard to do without some dedicated time and resources. The data core and all the cores within StARS also are available to provide technical assistance around any topics. So if you are proposing to link two different data sets that, again, have historically been challenging to do and you're not sure how to do it, the data core is here to help answer questions and guide you. We can't do the work for you, but we can help shuttle you down the right path and hold your hand along the way. We really want to discourage projects that are describing the linking of things that are seen as sort of simple or easy to do. So linking two data sets that are housed within the same agency or department that don't really require the infrastructure and support of StARS is something that would receive a lower score on an application. If you have, as you work through and think through your proposals, if you have questions about sort of how you're thinking about data linkage, we're here to help answer them and can provide one-on-one coaching around that. The second aspect related to data, which is really important for StARS and sort of the funding mechanism that funds the StARS program as a whole, is data sharing. We understand that there are a number of restrictions around what can and can't be shared, but we want to support projects that are able to share data at least at a minimum level in terms of metadata. We would prefer projects share data at a geographic program or provider level, and if possible, to share data at a de-identified person level. Again, we recognize that most projects are linking data that have a number of restrictions and really sensitive information. And so the level of data sharing that's possible is going to be dictated in part by sort of who owns the data. But it's really important to describe in your proposal some level of data sharing and what that looks like. And again, the Data Core and the other StARS centers are here to help answer questions as you think through your application about what may or may not be sort of perceived as acceptable or less desired as you think through this. And for those who are funded, we're here also then to help think and help cite grant recipients actually figure out the steps for implementing that data sharing plan. Catherine, Phil?
Phil, you're on mute.
Thank you so much. Yeah, I'm Dr. Philip Sloane. I'm one of the co-leads. I'm going to walk you briefly through the letter of intent application and several things about it. I want to say right off the bat. First of all, we tried to make it simple enough so that you don't have to write a whole bunch, and we put word limitations on every section so that you don't write a whole bunch even if you feel like it. And another thing about it is we walk through elements that are important for us in terms of our selection criteria. So it actually, the letter of intent application itself is supposed to help guide you to come up with a project that's more likely to be of interest and to meet our guidelines. So, the first, obviously, you have to put a title on it. And so your title should be, explanatory, but I'm talking to everyone knows how to put a title together. So not too many words, simple, saying what the key elements are. So let's move on to next. This is what we call the elevator pitch. Essentially, 150 word limit statement where you try to put everything together to explain exactly what you're doing as succinctly as you can, both what and why. And so we'll look at these first, and then we'll look at more of the details. Next, please. So next, we really want to know some information about the applying organization and the project lead. Now, I'd like to say that we noticed who signed up for this webinar, and most of you are academic settings. But then we were listening to Katherine as she was talking earlier. She said we funded states. And so I think the point to think about is we're interested in what states are doing and what's happening at the state level. And obviously the interaction between federal and state is of interest research-wise, but if there isn't a major state provider or state organization involved in your proposal, it's probably not going to reflect our interests. So projects should be conducted in or about the dementia services network within one or more states, which, as you know, is just really complex. So you don't have to get all the complexity, but getting something, shedding some light on that is going to be really important. Project should have one lead organization with preference for that organization being a state agency that is involved in dementia services. Now, when you look at what we funded, two of them, the leads were state agencies, and two of the leads were academics. So as long as academics have strong state partners, it's okay. And so potential partners may be another state, or academic organization, private company, or individual. In fact, what we found is that every project we funded was a partnership between some academic organization helped provide the academic chops to make it work well, plus robust state involvement. So in the following pages, please describe your applicant organization, the state within which you are located, primary person responsible for the grant if funded, and any partners you may involve. Next, please. So and then we really have sections about this. Describe the lead organization, how it fits with the provision of dementia services in the state. And then there's an opportunity to have a table or graphic to describe how dementia services are organized in the state and how your organization fits into it. Next, please. Next, we want to know what is the question you're trying to address, and specifically the gap in the provision, coordination, measurement, or understanding of state dementia services that the project will address. And so you can read that. Please explain the area of dementia services, service coordination will be the focus of your grant proposal, why it's important, and what gaps or challenges in current care provision it will address. Once again, a modest word limit, and that's your basically your reason for the proposal. Next, please. And from that, you talk about your goals. Now we know what the problem is that needs to be solved. Explain one or more goals that, if funded, you'll try to accomplish. Again, 200-word limit. It's sort of like a modest aim section. Next, please. And the method section will give you 500 words because we really want to know something about study population, data sources, measures you plan to use, and analytical plan. And we also are quite aware that if something is too ambitious and can't be done within a year, it probably won't be as well reviewed as one that has a timeline that looks manageable. Okay, next. So this fits into what Eric was talking about. We're really interested in thinking about what your potential is for data linkage and data sharing. And I'll just read this. One goal, as you know, is to support novel data linkages and promote sharing of resulting data resources either within your state or via the National Institute on Age's data linkage program to the extent it's appropriate or permissible by applicable regulations, laws such as HIPAA, that type of thing, making it easier for states to learn from each other and make comparisons. If you think about it, at one level, you can say there's 50 experiments going on in terms of how to best provide dementia services. And there's all kinds of interesting things happening at the state level, but they're often really siloed. And we're hoping through this data sharing to make it easier for states to learn from each other and maybe even compare each other's experiences. So we'd like you to describe newly collected or existing data sets that would be linked by your project, how you envision that your project, if funded, would include data that could be shared, and the infrastructure that we use to facilitate data sharing. Next, please. Ultimately, we're interested in access to care and provision of care. That's really the ultimate bottom line, of course. So we all know that Alzheimer's disease and related dementias are widespread across communities, but access to engagement with services often varies due to geographic, social determinants of health, and other factors that serve as either facilitators or barriers. So we'd like to know whether and how your proposed project can impact these issues in your geographical area. We're not asking to have the whole problem solved, but at least shed some light that will be helpful to moving forward so that it is used for something. Next, please. So we want something about your budget. We provide $110,000 in total costs. Originally, we kind of divided into direct costs and indirect costs, but different organizations have different rules and for this and different partners. So we just said, we got $110,000, however you want to divvy it up, just let us know. Let us know what it's for in general. And if you got a spreadsheet, that'd be great. Next. Finally, we just threw it. If there's something that doesn't fit within the requirements of this letter of I, something you think is really important, you just want to talk, you want us to know. Here's your opportunity to do that. And before we kind of move on and talk about, wrap this up, I did want to say a couple other things. We're not interested in funding pilot studies of small projects. That's a pilot of some element of care. And we're not generally interested in program evaluations either, unless there's some significant data integration around with other data sources. So I know because last year a number of folks came in wanting to do something, one of these, and were able to expand or modify so that they better fit our goals. So finally, last slide is about the review process. This is my last slide, okay? The letters of intent will be reviewed based on feasibility, the partnerships, data linkage and sharing, and policy practice impact. And those are elements that our reviewers will each have to evaluate for each proposal. It's a full review on our side. We'll consider the ability to complete the project in 1 year and within budget. And then we will select, as you heard, 6 letters of intent, because we don't want you to work really hard on something unless your potential for being funded is reasonably great. Now, we understand it takes time to put these together and really appreciate the time and interest you do to do this. And we found that even folks that ended up not being funded are figuring out other ways to use that. And so we hope this will be a useful thing for you as well as for us. Our selected letters of intent will be invited to submit full proposals with pre-application consultations provided by the StARS Center staff. And in fact, we even got some resources to provide some consultation during that letter of intent process. And I think Katherine's going to talk about that.
Thanks, Bill. So for those of you who like QR codes, you may scan it. And then there's links. Everything's on our website. And since you registered for this, we will send you information on how to apply. And that was really, and you can rewatch Phil explaining all the parts of your LOI as needed. I've started to answer some questions in the chat. I can go over them for everyone, but also to note, we can take questions live. We can take questions in the Q&A. We'll answer them live, but also we will have office hours available. So you can sign up. You can sign up under applying for funding on our website or just email starcenter@umn.edu. We have some time available to talk through what you want to do. And we did that with several states, many of which were successful last year, to get some ideas on how to move forward. I think, again, our goal is to get the best projects, to work with you to do that. So please don't hesitate if we can be helpful in that area. We can have folks join that if you have specific questions, for example, about some of the data sharing issues and so on. With that, I will just kind of go over, again, here's the key dates. I want to just go over some of the Q&A issues just so everyone can hear it, which is if you submitted previously, and you did not get funded, yes, you may resubmit. Sure. And in fact, please, we do give everyone feedback. If you've got feedback, I would recommend just reviewing it, seeing our concerns. As I said, we had a number of, excellent proposals. We just weren't able to fund all of them. So for sure, please consider that. Other questions, a new one that has come on is, does a for-profit organization, are they eligible to apply for the grant? What if it is a startup business? I believe the answer to that is yes.
Yes.
And they would need the right partner to do that. Other questions, the university does not have to be within the state. That's not the point. It's really more about what state, which state dementia care services are you ultimately supporting? And then there was another question about how folks are connecting with different health departments. This is a brilliant suggestion of how we do this. Email us if you are interested in this, if you are really looking for someone in a certain state and wanting to find a partner. We're not really actively engaged in that, but this has come up and we think this would be helpful. We also have a learning collaborative that we are initiating where we have different activities, information, and I think this one of the goals of that is to really help with partnerships like that. So thank you for the ideas and suggestions. The next question, is it possible to summarize what topics you are not interested in? I heard projects using only one data set or evaluating programs. Anything else?
I'm in the process of typing a response. And the answer is, we want to keep reasonably open because you might come up with something we haven't thought of. And so, what the general goals are, and within the goals, you be creative and think about what might be meaningful, that you have the resources and within your state or a couple of states, you can really shed some light on service provision within the state and help generate data that others might find useful. So,
and if you're not sure, you would benefit from signing up for some office hours and run the question by us. We do not, that's why we do LOIs first before we set you off on writing a full proposal. We want you to, kind of get things right. And as Phil said, we don't know what we don't know. So your state may be doing something really interesting, we haven't considered, and we're open to it. Just convince us.
Now, here's an interesting question because it came up last year too. If we contact you afterwards, could you share who participated from our state in these calls? And I think that's an interesting point because obviously you don't want to have two competitors coming from the same state, although we did have that last time. Um, we didn't. I don't think we put out a list of um, who signed up because in a way it's confidential. I think that's what we decided. But if we know that a couple of different organizations are applying from the same state, we kind of we did let them know. Catherine,
Yeah,
can you remember what we did?
yeah, I think it's sort of a great idea, but we're trying to be respectful, I think, of people. I think if you are interested in connecting with others, if you want to send an email, and let's say you're from, a big state like California, you suspect there may be others, and you want to say, "Hi, my name is Joe Smith. Can you let others know I was here and they can contact me?" We'll happily do that. But I definitely recommend that you should follow up, and we'll send information about this to all participants around our learning collaborative. And, again, with the idea we should partner and learn from each other. That is a goal.
And since you mentioned it, maybe we should say something about learning collaboratives because StARS has some other things that we do to try to help foster both knowledge and knowledge sharing. Uh, who can speak best about them? Justin, Bacon?
Well, the Learning Collaborative is we have monthly events for folks in the sort of in our community at large, where we have speakers, where we can learn a little bit more about maybe how one state is collecting data, what kind of challenges they have, some new resources available for folks. So the idea is to kind of have a community to connect. And then again, if you have some ideas around that, you can email our StAR Center email if you want to do more of that. And that's part of what our Learning Collaborative is doing. And I can't tell you how much just hearing your questions and getting feedback actually helps us to do this well. So thank you.
Thank you, Catherine. That's a good summary.
Great, thank you. So do think about signing up for the office hours, particularly if you've got questions. And usually I'm there for 15 minutes. You'd be surprised how much we can do in 15 minutes. And essentially the first question is, what are you thinking of doing? And then from there we evolve into discussion. So, but do review what we have in mind and think about what you have in mind and see if there's a good, solid match. Oh,
Other
see,
questions?
yeah, yeah. The Learning Collaborative is for anybody who's interested. And when's the next one? Kate, I see that Katie, who coordinates them, is on. Can you share when the next one is?
Yeah, the
Yeah.
list is now online. Brian just posted it. So
Ooh,
all of the webinars that we've done, you can click on this website to find it.
We
And
don't have a
anyone,
okay.
date for our next one, but if you join our mailing list, you'll definitely hear about them.
Mhm. And anyone can join. You're not just a grantee, a potential grantee, an interested party. We are, please feel free to join. Um, Um, for the question is, I have a partner looking to apply. They already have a project funded by the Bold Center. If their application focuses on expanding that project, is that possible? The answer is yes. We have had folks doing that. What we're still looking for is this possible within 1 year? And are we specifically doing more in this related to data sharing and data linking? So that might be helpful too to have a consultation if you're not exactly sure, but there is precedent for that. Other questions? Well, we'll stay on for a few minutes. If folks, want to leave, they can. This will be recorded, and you can think about this, look at the materials, and continue to ask questions. That's why we're trying to give you the time for that. So thanks, everyone. Thanks for your questions. Thanks for being part of this. And again, please give feedback. That helps us do better.
And do please fill out the evaluation because we're doing this to be helpful, and so we want to know um, what you think and whether you have any substantive feedback about what we might be able to do different next time.
Okay.
Does the grant, is it only to serve people with dementia or to prevent or delay dementia?
The priority is on dementia care. So, so we're less interested in, a new medication that is delaying dementia. I mean, that's wonderful and we want that. But the grant is really about integrated care. We do have some work around screening because obviously it's a continuum. But really the priority, I would say, would be focusing on serving the community with dementia. Phil, do you want to add to that?
I think you just you hit the nail right on the head. That we did fund one project that is focusing on finding and identifying and that whole diagnostic process. Because as you know, people can have cognitive impairment for years before they have the final diagnosis. Sometimes they're getting services and this type of thing. So we don't need a dementia diagnosis, but it's about dementia services. And the only other thing, this is sort of not exactly on topic, but there are just so many places that people can turn for dementia services within any geographic area. Learning more about how they work together or don't work together, or how to access that whole panoply of possibilities is usually some of the funding comes from Medicaid, some of it, very little comes from Medicare, I guess, except for medical services. But a lot of it is state organizations or volunteer organizations, and so think broadly about where the gaps are, and there are plenty of them. So we look forward to seeing what you come up with.
Yes. So thanks again for joining. I think we've answered all the questions. Please reach out via email, sign up for technical assistance when, if you need more information from us. Thanks, everyone.